Hey everyone, I decided to do a infograph on ankylosing spondylitis. So this is a condition that's considered a seronegative spondyloarthropathy joint disorder, which is a mouthful. But basically this condition is a chronic inflammatory condition that ultimately results in the fusion of your spinal joints. So the etiology and pathogenesis is kind of unknown, but it's thought to be both genetic and environmental. People who display this certain HLA-B27 gene are at a much higher risk for this condition. Um, so this gene is going to react with its environment to kind of overproduce this thing called interleukin 17, which is a pro-inflammatory cytokine. So that's going to lead to more inflammation in your body, and that's going to lead to these kind of chronic symptoms that we're going to see right here. So these symptoms can include, but it's not really limited to, back pain, sacroiliac joint pain, impaired range of motion in your spine. You also might see some limited chest mobility and chest expansion and rib mobility, and might even see a little bit of pain with breathing and things like that. So when it comes to diagnosing this disorder, you can do it either through lab testing or through imaging. So for lab testing, you're going to have an elevated ESR, CRP, and the presence of that HLA-B27 gene that we talked about. And also, the rheumatoid factor test will actually oftentimes be negative, which is why this is considered a seronegative spondyloarthropathy. As far as imaging goes, it can be done either through just a plain radiograph or an MRI. And kind of what you can see in that plain radiograph is something that is often referred to as bamboo spine. So that's when your spine is actually fusing and it kind of looks like bamboo. So that's something to kind of keep an eye out for if you ever hear anything like that from your doctor. So for medical management, you can have this through kind of medication as well as physical therapy. So when it comes to medication, this can be managed through DMARDs, TNF inhibitors, or drugs that inhibit that IL-17, which is what we talked about, the pro-inflammatory cytokine, because you're producing too much of that. So examples of these drugs would kind of be things like methotrexate, Enbrel, and Cosentyx. In addition to medication, it's also really important that you are kind of attending a normal routine of physical therapy. So physical therapy can help you kind of manage your symptoms. Like we said, you're going to have, you might encounter some, chest expansion problems or rib mobility. So you might have trouble breathing. That can kind of limit your activity and what you like to do. So it's definitely important that you can kind of get into a physical therapist and do exercises that can help combat that, so you can kind of get back to doing your everyday things. And also just strengthening your back and neck can kind of help with any kind of postural problems you might be having. So that's also very important. And yeah, so I just think that this infograph is something that you can easily, print out or email to a patient, and it kind of goes over all the kind of important things to look out for. And yeah, so I hope you guys enjoyed it. Let me know what you think, and thank you.